Doctor, this patient presents with cyanosis of the distal limb and is complaining of intermittent claudication of his left leg. His posterior tibial and dorsalis pedis pulses are both monophasic, suggesting peripheral arterial disease. I think we're going to have to bring him in for surgery. I agree. Let's get him prepped and bring him in. But are we ready? We're about to go in to do a percutaneous transluminal angioplasty of the femoral artery. But wait, where should I make the incision? And actually, where do I find the artery? Maybe we should revise the main arteries of the lower limb before we begin, which is exactly what we're going to learn about today. In order to keep things as simple as possible, we'll explore the main arteries of the lower limb through 4 main regions: the hip and thigh, the knee, the leg, and the foot. This will aid in developing our understanding of the area or region which these arteries supply. We'll finish this tutorial by taking a quick look at a clinical note related to one of the major arteries of the lower limb. So let's begin. Like the rest of the body, the arterial supply of the lower limb originates from the aorta, which delivers oxygenated blood from the heart. The abdominal aorta terminates around the level of the pelvic brim, where it divides or bifurcates into 2 common iliac arteries. The common iliac arteries divide further into internal and external iliac arteries, which supply structures within and around the pelvis, perineum, and lower limb. The external iliac artery courses inferiorly and does not enter the perineum. It travels beneath this structure here, which is known as the inguinal ligament, to enter the thigh. One of the main roles of the external iliac artery is to supply the lower limb. However, it does supply some structures of the anterior abdominal and pelvic walls. The internal iliac artery travels within the pelvic cavity, dividing into numerous branches to supply the pelvic walls and organs, the external genitalia and perineum, as well as the gluteal region and medial thigh. Therefore, we can say that all arteries of the hip and thigh region originate as branches from the internal and external iliac arteries. Let's take a closer look at some of the branches which supply the hip and the thigh region now. The obturator artery is one of the branches of the internal iliac artery that supplies the medial aspect of the anterior thigh, supplying muscles within this region as well as the head of the femur. Another branch of the internal iliac artery, relevant to the lower limb, are the gluteal arteries. Both superior and inferior gluteal arteries arise from the internal iliac artery within the pelvis and travel posteriorly to reach the muscles of this region. The main artery of the lower limb is the femoral artery. The femoral artery originates as a continuation of the external iliac artery, as it travels deep to the inguinal ligament. It gets its name from the Latin word femoralis, which means of the thigh. It continues beneath the inguinal ligament to reach the anterior thigh. The femoral artery can be palpated within a small medial subregion of the upper anterior thigh, the femoral triangle. The femoral triangle is bordered by the sartorius muscle laterally, the adductor longus muscle medially, and the inguinal ligament superiorly. So if you ever need to find the femoral artery, just find one of these muscles and work your way in or out. The proximal part of the femoral artery gives off several smaller branches to the anterior abdominal wall and superficial pelvis. However, the main branch of the femoral artery is the deep femoral artery, or the profunda femoris artery, as it is also known. This artery travels deep to the femoral artery and gives off what are known as perforating branches posterior to the femur to supply the posterior thigh. Circumflex branches of the deep femoral artery also supply the neck of the femur and hip region. As the femoral artery descends through the thigh, it travels through a hiatus, or opening, along one of the large muscles of the medial thigh, the adductor magnus. At this point, this artery becomes known as the popliteal artery. After passing through the adductor magnus muscle, it curves around to reach the hollow of the back of the knee, the popliteal fossa. The short popliteal artery lies deep within the popliteal fossa and is surrounded with fat, therefore sometimes making it a tricky artery to palpate. The knee region is supplied by several small interconnected genicular arteries, which mainly originate from the popliteal artery. The genicular arteries connect or anastomose with the surrounding small arteries of the leg and thigh to supply the knee. An anastomosis is any connection between adjacent blood vessels, such as arteries. Now let's take a look at the arteries that supply the leg. Moving distally to the leg, we can see its main arteries originate as a continuation of the popliteal artery. As the popliteal artery travels to leave the popliteal fossa, it bifurcates into two terminal branches, the anterior tibial and posterior tibial arteries. The anterior tibial artery travels between the tibia and fibula to reach the anterior compartment of the leg and supplies all muscles of this region. It gives off further branches around the ankle region and to the foot, but we'll look at these in just a moment. The other terminal branch of the popliteal artery, the posterior tibial artery, continues distally through the posterior leg, supplying its muscles as well as the tibia itself. The posterior tibial artery terminates between the medial malleolus and the calcaneus on the plantar aspect of the foot. This part of the artery runs quite superficially within this region and therefore can be easily palpated. Why not try it on yourself using your index and middle finger? One of the main branches of the posterior tibial artery is the fibular artery, which branches shortly after the terminal bifurcation of the popliteal artery. It supplies the muscles of the posterolateral aspect of the leg as well as the fibula. At the distal end of the leg, we meet a network of connecting vessels known as the malleolar arteries. These arteries supply the ankle region and are named after the knobbly, bony protrusions of the ankle, the malleoli. The malleolar arteries include the medial malleolar branch of the posterior tibial artery and the lateral malleolar branch of the fibular artery. The final region of the lower limb is the foot. The foot is divided into superior or dorsal and inferior or plantar regions of the foot. The dorsal region faces upwards, while the plantar region is the surface that makes contact with the ground, or the sole of the foot. Arteries that supply these regions originate from the anterior and posterior tibial arteries. The dorsalis pedis artery, dorsalis for the dorsal aspect of the foot, and pedis referring to the foot, is the distal continuation of the anterior tibial artery in the foot. This artery supplies muscles of the dorsal region of the foot. The dorsalis pedis artery travels quite superficially on the dorsal surface of the foot and therefore can usually be palpated along its route. The dorsalis pedis artery gives off several branches: the medial and lateral tarsal arteries, the arcuate artery, before finally terminating as the deep plantar artery, and the first dorsal metatarsal artery. Let's take a quick look at each of these branches now. The medial and lateral tarsal arteries are two branches that arise from the dorsalis pedis artery on the dorsum of the foot. These arteries supply the tarsal region. The tarsal region is made up of the proximal 7 tarsal bones of the foot. The lateral tarsal artery anastomoses with the arcuate artery at the base of the metatarsal bones, supplying structures within this region, while the medial tarsal artery travels over the medial tarsal bones and anastomoses with the medial malleolar network. Another branch of the dorsalis pedis artery is the arcuate artery. This artery remains on the dorsal surface of the foot at the base of the metatarsals, supplying muscles and structures of that region. Before anastomosing with the lateral tarsal artery, the arcuate artery gives rise to the dorsal metatarsal arteries, which travel alongside metatarsals 2 to 5. The first dorsal metatarsal artery, which travels alongside the first metatarsal, arises directly from the dorsalis pedis artery. The dorsal metatarsal arteries terminate as they reach the phalanges, or bones of the toes, and continue as the dorsal digital arteries. These digital arteries supply the dorsal toes or digits, as they are correctly termed. The deep plantar artery travels between the first and second digit to connect with the deep plantar arch on the plantar surface of the foot. The final arteries of the foot are the plantar arteries. As the posterior tibial artery travels down the posterior aspect of the leg, it travels posterior to the medial malleolus to reach the sole of the foot. It then terminates as a bifurcation, forming the medial and lateral plantar arteries of the foot. The medial plantar artery travels up to the tip of the great toe, or hallux, as it is anatomically termed. It supplies the structures of the medial aspect of the sole of the foot. The lateral plantar artery begins to travel up the lateral aspect of the foot but takes an abrupt turn to form an arch on the plantar surface of the base of the metatarsal bones. This arch is known as the deep plantar arch of the foot, and it gives off perforating branches, which are known as the plantar metatarsal arteries. These arteries supply the plantar surface of digits 2 to 5. The deep plantar arch terminates by anastomosing or connecting with the deep plantar artery in between the first and second metatarsal bone. Now that we've met all the main arteries of the lower limb, let's take a quick look at some clinical notes. That drama preview that we saw earlier seemed pretty intense, didn't it? Why don't we pick up where we left off and find out what a percutaneous transluminal angioplasty is? As with any artery in the body, narrowing or blockages due to plaque and atherosclerosis may develop. When this occurs within the femoral artery, the lower limb suffers, as there is a decrease in blood flow to this region. A decrease in blood flow to the lower limb can lead to poor healing abilities, necrosis, and if left untreated, even amputation. That's why it's important to carry out a percutaneous transluminal angioplasty of the femoral artery. This procedure is minimally invasive and avoids the risk of open vascular surgery. The femoral artery can easily be accessed through the femoral triangle of the anterior thigh. Once the blockage is located, a catheter with a small balloon at its end is inserted into the artery. When the catheter has reached the site of narrowing, the balloon is inflated to push away all the plaque and buildup that was blocking the artery. A stent can then be inserted to keep the artery open and maintain blood flow to the lower limb. Now we've come to the end of the tutorial on the main arteries of the lower limb. Let's have a quick look at what we learnt today. We began this tutorial by identifying where the blood supply of the lower limbs originates from. The aorta carries oxygenated blood from the heart through the thorax down through the abdomen to divide into two common iliac arteries. The common iliac arteries further divide into the external and internal iliac arteries. The obturator artery is a small artery on the medial aspect of the anterior thigh. This artery originates from the internal iliac artery and travels medially to supply the head of the femur and thigh. The gluteal arteries are also branches of the internal iliac artery and leave the pelvis posteriorly to supply the gluteal and hip region. The femoral artery is a continuation of the external iliac artery and is the main artery of the lower limb. The femoral artery supplies the anterior and medial thigh region. One of the main branches of the femoral artery is the deep femoral artery. This artery supplies the posterior thigh. The popliteal artery is the continuation of the femoral artery. This artery is the main blood supply to the knee. The popliteal artery sits posterior to the knee within the popliteal fossa and gives off small branches which anastomose and supply the medial, lateral and anterior knee. Moving from the knee to the leg, we met the anterior and posterior tibial arteries. The popliteal artery bifurcates at the inferior popliteal fossa into the anterior and posterior tibial arteries. The anterior tibial artery curves around to the anterior leg and supplies this region, while the posterior tibial artery supplies the posterior leg. The posterior tibial artery gives off the fibular artery, which supplies the posterior and lateral aspects of the leg. As the anterior tibial artery travels down the leg, it gives off small malleolar branches at the ankle. These arteries supply the ankle region. The anterior tibial artery terminates at the anterior ankle and continues as the dorsalis pedis artery. The dorsalis pedis artery branches into the tarsal arteries, arcuate artery, and first dorsal metatarsal artery, before terminating as the deep plantar artery. The arcuate artery remains on the dorsum of the foot, giving off the dorsal metatarsal arteries, which supply digits 2 to 5. The first dorsal metatarsal artery, along with the rest of the dorsal metatarsal arteries, continue as the digital arteries to the toes or the digits. The deep plantar artery travels inferiorly to the sole of the foot to anastomize with the deep plantar arch. The posterior tibial artery terminates by dividing into the medial and lateral plantar arteries as it reaches the sole of the foot. The medial plantar artery supplies the medial aspect of the foot, while the lateral plantar artery supplies the lateral proximal foot and forms the deep plantar arch of the foot. The deep plantar arch gives off branches which supply the digits of the plantar aspect of the foot. The deep plantar artery anastomoses with the deep plantar arch between the first and second metatarsal. We then came to some clinical notes. Here we explored the complications of atherosclerotic buildup within the femoral artery and how to remove these blockages using a percutaneous transluminal angioplasty of the femoral artery.
On the femoral artery and its branches. The femoral artery is the major blood supply to the lower limb. It supplies most of the thigh as well as the entirety of the leg and foot. During this tutorial, we'll go over the anatomical course of the femoral artery and talk about its branches. To finish up, we'll go over a few clinical points about the femoral artery, which are helpful to know in clinical practice. So in this illustration, we can see the femoral artery highlighted in green, with the surrounding soft tissues removed. We can also see the transition from the external iliac artery to the femoral artery as it passes underneath the inguinal ligament, which is this structure here. So the first thing you need to know about the femoral artery is that it is a continuation of the external iliac artery. As you can see in this image, the aorta bifurcates into two common iliac arteries. Each common iliac artery then bifurcates into the external iliac artery and the internal iliac artery. Two notable branches of the external iliac artery are located in this region here, so now let's discuss them in more detail. The vessel highlighted in this image, just before the external iliac artery passes under the inguinal ligament to become the femoral artery, is the inferior epigastric artery. This vessel always arises just before the external iliac artery reaches the inguinal ligament. It passes up via the transversalis fascia and then pierces the rectus abdominis muscle. Now let's see another artery, which arises nearly at the same level as the inferior epigastric artery, but on the opposite side. This is the deep circumflex iliac artery, which, as you can see, arises from the lateral aspect of the external iliac artery. I must mention that this image is slightly misleading, as it appears that the deep circumflex iliac artery originates after the inguinal ligament as a branch of the femoral artery. However, this is not the case. This artery is a branch of the external iliac artery and arises at the level of the inguinal ligament, where the external iliac artery becomes the femoral artery. It ascends obliquely and laterally, posterior to the inguinal ligament, and then it travels to the anterior superior iliac spine, where it anastomoses with the ascending branch of the lateral femoral circumflex artery. Okay, so we've successfully established that the femoral artery is a continuation of the external iliac artery. But where does the femoral artery begin? The ligament highlighted here in green is known as the inguinal ligament. You can see in this image that the external iliac artery passes beneath this ligament. It passes under the inguinal ligament about halfway between the anterior superior iliac spine, which is an important bony landmark of the hip bone, and the pubic symphysis, which is a joint that unites the two pubic bones of the hip. The femoral artery is said to begin at this point, where the external iliac artery passes under the inguinal ligament. So in this illustration, we can see the inguinal ligament here running between the anterior superior iliac spine and the pubic symphysis here. About halfway, we can see the external iliac artery passing underneath this structure to become the femoral artery. So now let's have a look at the femoral artery. The femoral artery, after passing below the inguinal ligament, travels down the anteromedial aspect of the thigh, giving off many muscular branches before it enters the adductor hiatus to become the popliteal artery. So first we'll discuss the course of the femoral artery through the regions of the thigh, and then we'll talk about the vessels that branch off the femoral artery before the origin of another major vessel, which is the deep femoral artery. Finally, we'll discuss the courses and branches of the deep femoral artery. The femoral artery enters the thigh in a region known as the femoral triangle. The femoral triangle is a wedge-shaped depression found inferior to the inguinal ligament. As we can see in this image, this triangle is bounded by the inguinal ligament superiorly, the adductor longus medially, and the sartorius muscle laterally. The fascia lata has been removed in this image, but normally it forms the roof of the femoral triangle. Another thing to note is that within the femoral triangle, the femoral artery is enclosed in a sheath with the femoral vein. This sheath is known as the femoral sheath, but it does not contain the femoral nerve, only the femoral artery and vein. A useful way to remember the contents of the femoral triangle is the acronym VAN. So from medial to lateral, we have the femoral vein for V, the femoral artery for A, and the femoral nerve for N. We can also see some inguinal lymph nodes in this triangle. So to help you organise and remember the borders of the femoral triangle a bit more easily, I'm just going to go through them systematically in this one slide. So the superior border is the inguinal ligament, the medial border is the muscle adductor longus, and the lateral border is the sartorius muscle. And just as a reminder, the femoral sheath is a connective tissue sheath that contains the femoral artery and vein. So let's quickly summarise the anatomical course of the femoral artery. It begins as it passes under the inguinal ligament, halfway between the anterior superior iliac spine and the pubic symphysis. It then passes through the femoral triangle before passing down the anteromedial aspect of the thigh, superficial to the adductor magnus and longus muscles. It then passes through the adductor hiatus, where it ends and becomes the popliteal artery. In this illustration, we can see the femoral artery passing through the adductor hiatus to become the popliteal artery. So now we're ready to discuss the branches of the femoral artery. The first branch we'll talk about is the superficial epigastric artery. The superficial epigastric artery is highlighted in this image in green, and as you can see, it arises about 1 centimetre below the inguinal ligament. It travels through the cribriform fascia and descends towards the abdominal superficial fascia. The cribriform fascia is a region of the superficial fascia of the thigh that's perforated. The name cribriform is derived from the Latin word cribrum, which means sieve. This artery supplies the skin of the inguinal region, superficial fascia, and superficial inguinal lymph nodes. The next branch we'll talk about is the superficial circumflex iliac artery, which is the smallest branch of the femoral artery. It arises almost at the level of the superficial epigastric artery, which is the branch that we just talked about. The superficial circumflex iliac artery passes through the fascia lata before coursing towards the anterior superior iliac spine. Like the superficial epigastric artery, it supplies the skin, the superficial fascia, and the superficial inguinal lymph nodes. Now let's move on to the next branch of the femoral artery. This artery is known as the superficial external pudendal artery. It arises slightly below the first two branches, the superficial epigastric artery and the superficial circumflex iliac artery. It travels through the cribriform fascia before crossing the spermatic cord deep to the long saphenous vein. This artery supplies the lower abdominal skin, as well as the penile, scrotal or labial skin. Another branch the femoral artery gives off in the proximal thigh is the deep external pudendal artery. As you can see, this artery arises slightly below the superficial external pudendal artery. Like the name suggests, this artery is found more deep to the superficial external pudendal artery. This artery is covered by fascia lata and passes medially over the pectineus and adductor longus muscles. Following this, it pierces the fascia lata to supply the skin of the scrotum or labia major, as well as the skin of the perineum. We will now discuss the largest branch of the femoral artery, which is the deep femoral artery. This artery is also known as profunda femoris, or the deep artery of the thigh. As we can see in this image, the deep femoral artery arises laterally from the femoral artery, approximately 3.5 centimetres below the inguinal ligament. It then continues down the lateral aspect of the thigh before it pierces the adductor magnus to anastomose with the muscular branches of the popliteal artery. The deep femoral artery is the main blood supply to the muscles that extend, flex, and adduct the thigh, and is therefore referred to as a muscular branch of the femoral artery. The deep femoral artery itself gives off many branches, including the lateral circumflex femoral artery, the medial circumflex femoral artery, and the perforating arteries. Let's have a look at the most important of these arteries, the lateral circumflex femoral artery. As we can see in this image, the lateral circumflex femoral artery arises from the lateral aspect of the deep femoral artery. It runs deep to the sartorius and rectus femoris muscles and divides into ascending, descending, and transverse branches. We'll now have a look at these branches in more detail. Here we can see the ascending branch of the lateral circumflex femoral artery. This branch ascends along the intertrochanteric line of the femur and supplies the greater trochanter, which is this bony landmark here. The transverse branch arises laterally and travels superficial to the vastus intermedius muscle. It then pierces the vastus lateralis before it anastomoses with the smaller arterial branches of the lateral surface of the thigh. The final branch of the lateral circumflex femoral artery, or the descending branch, descends deep to the rectus femoris and along the anterior border of the vastus lateralis. It supplies the vastus lateralis muscle. Okay, let's move on to the medial circumflex femoral artery. This artery usually originates from the posteromedial aspect of the deep femoral artery, close to its origin. The medial circumflex femoral artery divides into several branches and supplies the femoral neck as well as the adductor muscles. The deep femoral artery also gives off some perforating arteries. They're called the perforating arteries because they perforate the adductor magnus muscle. This artery, highlighted in green, is the first perforating artery, and it supplies the adductor brevis, the adductor magnus, biceps femoris, and gluteus maximus. In the next image, we can see the second perforating artery, which is longer than the first and supplies the muscles on the posterior aspect of the thigh. It usually divides into ascending and descending branches. Next, we have the third perforating artery, which also supplies the posterior thigh muscles. The final branch of the femoral artery we'll talk about is the descending genicular artery. This artery is the most distal branch of the femoral artery and arises just proximal to the adductor hiatus. The descending genicular artery descends within the vastus medialis muscle, which has been removed in this illustration to show the artery here. This artery and its branches supply the vastus medialis and adductor magnus muscles, as well as the proximal medial skin of the thigh. Finally, to end this tutorial, we will discuss some clinical notes on the femoral artery that are relevant to clinical practice. The femoral artery can be palpated in order to feel the femoral pulse. The best place to palpate the pulse is midway between the anterior superior iliac spine and the pubic symphysis, just inferior to the inguinal ligament. If the pulse is diminished, this may indicate partial occlusion or blockage of the common iliac artery or the external iliac artery. It may also indicate aortic coarctation, which is a congenital condition that causes narrowing of a segment of the aorta. Another thing that's important to note is that the femoral artery is a common site for cannulation, as it provides access to the heart as well as various other vessels. Cannulation is a procedure carried out in medical practice where a small tube known as a cannula is inserted into a vessel. Coronary artery angioplasty is a common intervention used in coronary artery disease, which involves cannulation of the femoral artery. After successful femoral artery cannulation, a catheter is inserted into the femoral artery and passed through the various arteries such as the common iliac artery and aorta before it reaches the coronary artery. A wire and a balloon are then used to dilate the coronary artery. The final clinical points we will talk about are femoral artery laceration and femoral artery occlusion. Due to its superficial position within the femoral triangle, the femoral artery is vulnerable to laceration. In anterior thigh wounds, the femoral vein is also commonly lacerated due to its close proximity with the femoral artery. Femoral artery occlusion can be caused by atherosclerosis, which you can see in peripheral vascular disease. Atherosclerosis refers to when arteries become clogged up by fatty substances. Occlusion of the femoral artery can cause intermittent claudication of the calf. This is a cramp-like pain of the calf, exacerbated by movement and relieved by rest. And that concludes our tutorial on the femoral artery and its branches. I hope you enjoyed it, and thank you for listening.
Neurovasculature of the lower leg and knee. So what I'm going to be basically doing throughout this tutorial is describing the main blood vessels and also nerves that you see on the lower leg, as you see also on these three images. Now I'm going to be talking about the different arteries, veins, and nerves that we find on our lower leg. So below, the region below your knee and all the way to your foot. We're going to start off with then the different arteries that we find on the lower leg, and we're going to list them. And the ones that we're going to be including here on this tutorial or seeing on this region of your body are the popliteal artery, the anterior tibial, the anterior lateral and medial malleolar arteries, the inferior lateral and medial genicular arteries, and also we're going to be seeing then the superior and lateral medial genicular arteries, the posterior tibial artery. We're going to be seeing this one that can either be called the peroneal artery or the fibular artery. We're now ready to move on to the very first one that we saw on that list. And before you ask me what is going on this image, I'm going to just say that this is the back of your knee with the several muscles that we're going to be finding here on this region and some of the blood vessels and nerves. And we're highlighting the artery that we're going to be briefly talking about, the popliteal artery. Now, this blood vessel is the continuation of the femoral artery, which is the main arterial blood supplier of your leg. It runs from the adductor hiatus until the lower margin of the popliteal muscle, where it divides then into the anterior and posterior tibial arteries. And during its course, the popliteal artery gives off several branches that will be then covered on the next slides. We're going to be turning now the leg onto an anterior view where we're highlighting this structure here known as the anterior tibial artery. And this artery is one of the two continuations of the popliteal artery and runs from the lower margin of the popliteal muscle ventrally or anteriorly towards the back of your foot, or also known as the dorsum of the foot, a fancier way to call the back of your foot, which you partially see here on this image. Now at this point, this artery continues as the dorsal artery of the foot. Distally, the anterior tibial artery gives off two branches, which we will be talking about or seeing here highlighted in green. On the left image, we're looking at the anterior medial malleolar artery. And on the image on the right side, we're looking at the anterior lateral malleolar artery. Some tongue twisters here for me at least. These arteries are coming out of the anterior tibial artery and start shortly above the ankle joint and run towards the medial and lateral sides of the ankle in order to supply these regions with blood. And they also form anastomosis. Now, just for clarification, this is the medial side of your foot where you have then, or this is the same direction of the big toe. This is going to be then the lateral side where you have your little toe, and you notice how these two malleolar arteries are then moving towards these sides of the ankle. We're going to now focus here on the anterior medial malleolar artery to say that this one runs below the tendons of the extensor hallucis longus muscle and goes medially where it splits up into many small branches. It forms an anastomosis with the posterior tibial artery and the medial plantar artery. The next one that we're going to be now highlighting that we've seen on previous slides, this is then the anterior lateral malleolar artery. And the lateral one runs below the tendons of the extensor digitorum longus muscle and goes laterally towards the lateral malleolus. Just for a bit of location here, this is then the lateral malleolus. It forms an anastomosis with the ramus perforans, or the perforating branch of the fibular artery, and the lateral tarsal artery. We are going to move on now to a set of different arteries which are known as the superior and inferior medial and lateral genicular arteries. And as a source of comparison, we're going to put them all together. The first one that you see now on the screen, highlighted in green, is known as the superior lateral genicular artery. And keep in mind that we're looking at the posterior view of the lower leg and knee. You even notice a bit here of the femur and a bit of the tibia as well. And this is where you should see the posterior view of your knee. The other one that is now seen here highlighted in green is then on the other side, and we call it the superior medial genicular artery. And we're going to find this one also on a posterior view here, which is known as the inferior lateral genicular artery. And now that we just removed here some of the muscles, you can now see clearly the knee joint. And where these two are in comparison, then the superior ones are in comparison to the lower one, or the inferior ones. The other artery is known as the inferior medial genicular artery. So 4 arteries that we're going to be discussing next. But you can see them all together on these images and see how they relate to one another. These arteries are all branches of the popliteal artery, and the 4 genicular arteries run towards the 4 quadrants of the popliteal fossa. They form anastomosis in order to create an arterial network so that good blood flow is granted in this region of your body. We're going to now pay a little bit more focus here on this one, and if you remember from that collection of images, we're now looking at the inferior medial genicular artery. This one runs around the medial condyle of the tibia, as you can see here. This is the medial condyle of the tibia, and supplies the proximal part of the tibia and the knee joint partially. This artery forms anastomosis with the superior medial genicular artery and the inferior lateral genicular artery. And if we look here at the anterior view of the knee, you can clearly see here the anastomosis happening. So this is the inferior medial genicular artery anastomosing with then the superior medial genicular artery, as well as the inferior lateral genicular artery. The next one that we saw also on those images, and we're highlighting here from an anterior view of the knee joint, this is known as the superior medial genicular artery. This one is a small artery that runs cranially from the medial epicondyle around the femur, as you can clearly see here. This is the medial epicondyle of the femur, and you see the positioning of this artery in relation to the femur. In this area, the artery will be supplying parts of the quadriceps femoris muscle and the knee joint. It also forms several anastomoses, including anastomosis with the inferior medial, as you can see here, the inferior medial genicular artery, as well as the superior lateral genicular artery. Next in line is going to be this one that you see here highlighted in green. Now we're looking at a posterior view. And if you remember from that list, yes, this one is the inferior lateral genicular artery. This one runs laterally around the head of the fibula towards the anterior side of the knee joint, supplying then the knee, like the other genicular arteries. Don't forget the genus means knee. The branches of this artery are going to form anastomosis with the other genicular arteries as well. And you can see also this artery, the inferior lateral genicular artery, from an anterior view, seen here now highlighted in green. The last one on that list that we now see also from a posterior view, this is the superior lateral genicular artery. It runs below the tendon of the biceps femoris muscle towards the lateral condyle of the femur. And this is the lateral condyle of the femur, as you can see here. Supplies parts of the quadriceps femoris muscle and also the knee joint. As for anastomosis, this artery is going to be anastomosing with the other genicular arteries as well as the lateral circumflex femoral artery. We're going to be turning now to a posterior view to now highlight this structure, a posterior view of the lower leg and also your foot here. We're now looking at the posterior tibial artery, and the posterior tibial artery is one of the two continuations of the popliteal artery. Remember from the previous slides, I mentioned that the anterior tibial artery is one of these continuations. This one begins at the level of the popliteus muscle and runs caudally with the tibial nerve into the deep flexor group of the lower leg. And during its course, it gives off the fibular artery as well as several small branches towards different structures of the lower leg, like the tibia, the medial malleolus, as you can see here. This is the medial malleolus for location, the calcaneus, and the surrounding musculature. We're now ready to move on to the next artery here that you see highlighted also from a posterior view. One of the branches of the posterior tibial artery that is known as then the fibular artery, also known as the perineal artery. And as I mentioned, this one comes from the posterior tibial artery and runs along the lateral aspect of the fibula towards the foot, as you can see in this posterior view. During its course, it's going to give off several branches, several small branches, to then the surrounding muscles. Now that we covered the main arteries of the lower leg, it is time for us to move on and talk about the main veins that we find in this region. We're going to be talking about two, the popliteal vein and also the small saphenous vein. Let's start off with the very first one here on the list that you see now highlighted in green. Again, this is a posterior view of your knee, and we're looking at the popliteal vein highlighted in green. And just like the popliteal artery, which you can also see here on this image, the popliteal vein lies on the popliteal fossa. It drains blood from the lower leg via the anterior and posterior tibial veins and foot towards then the femoral vein. Together with the small saphenous vein, it enters the adductor canal where it becomes then the femoral vein. So always remember when we talk about veins, the trajectory here is going back from the extremities all the way to the heart. The next one that I just mentioned, now seen also highlighted in green, this is known as a small saphenous vein. It is a superficial vein of the lower leg that runs from the lateral edge of the foot below the lateral malleolus towards the dorsal side of the lower leg. Blood in the small saphenous vein is going to then flow into the popliteal vein. As you can also see here, this is the popliteal vein that we just talked about on the previous slide. The small saphenous vein forms several anastomoses with the deep veins of the leg. And before we do so, let's start off by listing the different arteries that we're going to be covering. We're going to talk about the dorsal artery of the foot, the lateral and medial tarsal arteries, the arcuate artery, also the dorsal metatarsal arteries, the lateral and medial plantar arteries, the deep plantar arch, and finally, we're going to also be talking about the plantar metatarsal arteries. Now let's start off with the very first one here on our list that is seen now highlighted in green. If you remember, this is then the dorsal artery of your foot. And the dorsal artery of the foot is then the continuation of this artery here, known as the anterior tibial artery, coming all the way from the lower leg. And the anterior tibial artery is the distal continuation of an important artery in the thigh and leg known as the popliteal artery. The dorsal artery of the foot then runs on the back of the foot towards the first and second toes. This artery has an importance or a clinical relevance as its pulse is easily felt when you search for it by slightly touching the dorsum of your foot or the back of your foot. And this artery also gives off several branches which are discussed on the next slides. Next arteries that we're going to be talking about, they are seen here highlighted in green. On the image on the left side, we're looking at the lateral tarsal artery. And on the image on the right side, we're looking then at the medial tarsal arteries. And keep in mind that on these images, we're looking at the dorsum of the foot. This is not the plantar view or the plantar side of your foot. These are two of the branches of the dorsal artery of the foot, the medial and the lateral tarsal arteries. And just for a bit of reference, we can see here that this is the medial side of the foot, since it's in the same direction as the big toe. And this part here is the lateral part of the toe of the foot, as this is on the same direction as the little toe. And you notice here that these arteries are projecting either laterally, as you can see here, or medially, hence their names as well. If we take a closer look here at the lateral tarsal artery, this one branches off at the level of the navicular bone and runs towards the lateral side of the foot. This artery is going to be supplying the metatarsal joints as well as the extensor digitorum brevis muscle. The next one that we also have seen already, these are known as then the medial tarsal arteries, which are made of several little branches that come from the dorsal artery of the foot and go towards the medial side of your foot. The medial tarsal arteries then supply the inner side of your foot. Ready to move on to the next structure that you see here highlighted in green. This is known as the arcuate artery. This one is a branch of the dorsal artery of the foot as well. Remember that the dorsal artery of the foot is seen right about here. It runs like an arch and gives off the dorsal metatarsal arteries. The arcuate artery runs over the base of the metatarsal bones from the medial to lateral sides and forms an anastomosis with the lateral tarsal artery and lateral plantar artery for a safe and efficient blood supply in this region. I mentioned before these arteries that we're now highlighting, these are known as the dorsal metatarsal arteries. They are radiating from the arcuate artery towards the metatarsal bones, and distally they each split into dorsal digital arteries that supply the toes with arterial blood. The next set that we're going to be seeing here, now we're looking at the plantar side of the foot. I just turned these images. And we're looking at two highlights here. On the left side, we have the lateral plantar artery. And on the image on the right side, we have then the medial plantar artery. These two arteries are branches of the posterior tibial artery. Remember that the dorsal artery of the foot is the continuation of the anterior tibial artery, and they run towards the medial and lateral sides of the sole of your foot. Let's take a closer look here at the lateral plantar artery. And the lateral plantar artery runs towards the lateral side of the foot until the little toe. It forms an anastomosis with the lateral tarsal artery and the arcuate artery. The lateral plantar artery is going to be supplying the skin and musculature of the lateral side of the foot. We also saw this one here that we're now highlighting. This is then the medial plantar artery. This one runs towards the medial side of the foot and follows the first metatarsal bone until your big toe. It will form an anastomosis with the first dorsal metatarsal artery. Next one on the list is seen now highlighted in green. We're still on the plantar side of the foot. This is known as then the deep plantar arch. And the deep plantar arch is an arterial arch being formed by the lateral plantar artery and the deep plantar artery, which is a branch of the dorsal artery of the foot. The deep plantar arch reaches the first all the way to the fifth metatarsal bones and then supplies the tissue of the sole of the foot. It also gives off the plantar metatarsal arteries, as you can see here on this image. And as I just mentioned, the next set that we're going to be highlighting now, if you remember, these are the plantar metatarsal arteries. They are radiating from the deep plantar arch, and just like the dorsal metatarsal arteries, they each split up into arteries known as the proper plantar digital arteries. And these will be then used for blood supply of the distal end of the foot.